Good evening, ladies and gentlemen. My name is Claudia Camerino. I come from the University of Bari and University of Rome Sapienza, and I'm at the Herbert Fleisch 2019 meeting on behalf of HubLE. And I'm actually interviewing all these nice, very ambitious, very prepared young people that remind of myself a few years ago. I really want to say it. So today I introduce you Dzenita. She did a long trip. She came from Australia. And please go ahead.
So my name is Dzenita Muratovic, and I'm coming from Adelaide University, Adelaide, South Australia. And I also want to mention that I was one of the winners for IFMRS Travel Award to attend ORC 19 meeting in Houston, Texas.
What do you present?
Today at Herbert Fleisch workshop, I'm presenting my some data from my PhD project that presented as a poster, and the topic is bone marrow lesion in presence of bone marrow lesion in tissue, especially the knee and their involvement in progression of knee osteoarthritis. So my work during my PhD, I was focusing on only on the knees because those lesions, how they called, are pathology of the subchondral bone, and they're only seen by MRI. Their importance is because they've been found that in clinical study that been in association with strong degeneration of the tissue, but also with the amount or the severity of the clinical symptoms such as pain. What I want to do during my PhD project is to explain or comprehensively investigate what they represent at tissue level. So we did we used several imaging modalities to find to explain what exactly this pathology means and how we translate this imaging finding in a clinic or directly to the patient. So one of my findings is that the two groups of the patient osteoarthritis patients is that those that have BML seen on a MRI and those the patient that they don't have. So the big finding is that it seems that the presence of BML is characterizing some specific tissue characteristics, which mean that can be used as imaging biomarker and help to clinicians to decide how to treat the patient. Those without bone marrow lesion in tissue, they had less degenerative changes in the tissue. So we believe that those patients without bone marrow lesion also can be more successful in treatment during the osteoarthritis.
Sounds extremely interesting, and it sounds like a very long and articulated project. In how many papers it already resulted?
So just last year, 6 months ago, I finished my PhD, so I'm Dr. Dzenita now. And yes, we published several findings. We published 3 papers, and the 4th one coming very soon, hopefully.
Congratulations. So, and this sounds like very clinical. So how does it benefit the patient? I think it will benefit quite practically and quite immediately, because it sounds such a clinical work.
Yes, I have 14 years of the work experience at the clinic, and suddenly I find myself that just working in normal diagnostic environment, you kind of limited, you can't help the patient. So I was drawn back to go to university and do PhD project. So I was looking for the project that actually will mix the basic science and the clinician. So when I do my work, I always have in mind the patient, and everything that I find, I try to translate to be directly used at the clinic.
So a travel grant was very well deserved, by the way. Next steps, so you just start your postdoc.
Yes,
so I ahead of you.
In a laboratory of the Professor David Finley, I continue to work on bone marrow lesion, but now we're going to explain molecular signature behind those bone marrow lesions. We want to see those molecules that might be involved in eliciting those lesions in the tissue, but also in the same time I start applying for my project grants. So I'm going now beyond just the knee. I want to look hip, I want to look facet joint disease, I want to look hand OA and see how really we can use these sophisticated imaging tools like MRI to help us in every day at the clinic.
Very nice. Young people must always be encouraged.
Thank you.